long weeks during which we experienced record-breaking numbers of COVID cases among the Omicron and post-holiday surge. Cases and hospitalizations, I'm happy to report, are declining. However, the number of people dying from COVID-19 is still high, although not as high as it would have been without the life-saving vaccines that have been available to us for about 14 months now. But one death due to COVID is one death too many. Unfortunately, today alone, we've announced 32 new deaths, which brings the total number of South Carolinians who've lost their lives with COVID-19 to 16,018. The majority of COVID-19 deaths, 64.2% as of our last analysis, continue to be individuals who are not fully vaccinated. And of those 103 fully vaccinated South Carolinians who sadly died during the period of our last analysis, all but two of them, so 98%, had comorbidities or underlying conditions that put them at greater risk for severe complications from COVID-19. The piece of data is incredibly telling, and it supports our ongoing message that vaccines don't just protect you. They protect the people around you, your family, and the people in your community. You can't always tell by appearance that someone has a health issue that makes them more susceptible to the virus. That is, if they get COVID, they aren't as lucky as you and may not just have a few mild symptoms. The virus knows how to overcome people with weakened immune systems, and though these susceptible individuals have done their part to get fully vaccinated and get their third doses and get their booster doses as recommended, because the virus remains so prevalent in our communities, it's continuing to hurt and kill people who have done all they could to try to protect themselves. I want to note that today we have also confirmed the first two cases of the BA.2 subvariant of the Omicron variant that were identified in South Carolina residents. These subvariant findings were reported to Dhec by an out-of-state reference lab. Early preliminary information about this subvariant suggests that it may be more transmissible than the original form of Omicron, but it does not appear to cause more severe disease nor are vaccines less effective against it than against the original Omicron. Though the numbers are trending downward in South Carolina and across much of the country, we can't let the number of people getting vaccinations follow and head that same direction. We must continue to work towards getting more South Carolinians fully vaccinated and boosted, including our children who are in group settings at schools every day. Vaccinations, continuous and proper mask wearing, and timely and appropriate testing continue to be the most effective tools for protecting our students and their dedicated teachers. For our state's Test to Stay program, which is dedicated to safely keeping our students and staff in the classroom, Dhec has ordered 1.6 million at-home rapid antigen tests, and distribution to schools began last week. For a long time, these at-home COVID tests were hard to find as the demand outweighed manufacturers' supplies, but the rapid antigen tests are now more readily available and are being provided directly to South Carolinians for free, both from Dhec and from the federal government. As residents receive their at-home COVID tests, I do want to take a moment to remind everyone of some important safety reminders for these tests. First, please read and follow all the directions that come with the test kits. There are different types of take-home tests, different brands, so read through the instructions to make sure you use it properly in order to receive accurate results in a safe manner. Second, don't leave the tests or the test kits within a child's reach. The tiny bottles of reagent solution can be an irritant and can be harmful if ingested, or the bottles or caps themselves could become a choking hazard. After use, keep that little bottle of reagent in the test box or even before you use it. That way you won't mix it up and potentially use it for some other unintended purpose, like mistakenly using it for eye drops. For anyone who has not received their at-home test kits, you can receive some for free via two ways. The federal government will mail you one package with 2 boxes, each with 2 tests, so a total of 4 tests per household, per home. Go to covidtests.gov answer a few basic, very short questions, and the kit will come in the mail to you. Or you can visit your local Dhec health department to pick up one free kit, one free box that includes 2 tests. In closing, while at-home tests are now becoming more widely available and COVID numbers are generally trending downward, we can't let our guards down now. Doing so too soon allows the virus to continue to thrive, create additional variants with even worse mutations, and continue to unnecessarily take lives. If you haven't received your vaccine yet, completed your vaccination series, or received your booster and you're eligible, please support the nearly 2.6 million South Carolinians and the 212 million Americans who are fully vaccinated and are doing their part to protect themselves and their fellow citizens. Thank you.
Thank you, Dr. Traxler. We're going to turn it now to our pre-submitted questions, of which I believe we have 5. Our first question today is, after you recover from Omicron, should you give blood, or how long do you need to wait to donate?
So I want to say that all eligible individuals are strongly encouraging. I am strongly encouraging them to donate blood because there is a severe blood shortage nationwide going on at the moment. And according to the Food and Drug Administration, a person who is diagnosed with or suspected of having COVID-19, including the Omicron variant, should wait 10 days after their symptoms completely resolve before donating blood. But again, once that 10 days has passed, once the symptoms have completely resolved, I definitely encourage blood donation to help save lives.
Thank you. Next question is, on the vaccine dashboard, I noticed that 4 counties, Pickens, Cherokee, Marlboro, and Chesterfield, are the last ones not to be 50% at least for one shot. I guess that's vaccinated. What's your thoughts on that, including any efforts to improve the numbers?
Sure. So these 4 are rural counties, but I don't think accessibility is necessarily playing a large part in the comparatively low vaccination rates, because they do have a large number of mini vaccine, locations in the counties. At this point in time, Pickens County currently has 24 vaccination sites, which is a pretty significant number of locations. Cherokee County has 10 or 11 sites. Marlboro County has 7 vaccination sites, and Chesterfield County also has about 10 or 11 sites. More vaccine sites are being planned for these counties, including some at the Dollar General stores that are often frequented and popular and located in rural areas. We're continuing to really work at that local level to form partnerships with trusted community groups and individuals to help encourage more people to get their shots in these areas. We've worked very hard to bring the vaccine to the people in the state. It's been one of our main goals for fair and equitable vaccine distribution from the get-go. Vaccine hesitancy may be more prominent in rural areas, so that could be part of what's at play here. Again, our regional teams continue to work to connect with local leaders and community groups to help get these vaccination rates increasing.
Thank you. Our next question is, are you seeing more people skip booster shots?
So I wouldn't say that people are necessarily skipping or foregoing their booster shots. Rather, I think that some people are getting it at their convenience, including delaying it for various reasons. Data from our vaccination dashboard shows that 2.5 million, almost 2.6 million people have completed their primary vaccination series, and about 930,000, or about 37% of those, have received their 3rd dose or booster dose. We do certainly need that percentage of the fully vaccinated people, who also receive a booster shot to increase, especially with Omicron as the dominant variant, and knowing and having data to show that a booster shot adds protection against Omicron for those fully vaccinated people.
I think your next question, also with boosters, what are the current guidelines for booster shots?
Sure. So for people age 12 and up who receive the Pfizer-BioNTech vaccine are eligible 5 months after their 2nd dose, after completing their primary series, to get a booster shot. People age 18 and up who received the Moderna vaccine are eligible 5 months after their second dose, after completing that primary series. And then lastly, people 18 and up who got that single dose Johnson & Johnson vaccine are eligible for a second vaccine dose 2 months after that initial vaccine shot.
And our final question today is, can you catch Omicron twice and experience symptoms?
I'm not aware of any data on reinfections where Omicron was the causative variant both times. There likely is not much yet known about this because Omicron was only first detected in the world, about 2.5 months ago. Data shows, and I have not heard differently about Omicron, but data from previous variants show that you potentially have some natural immunity or protection that you can depend on for up to 90 days. So we still are within that 90-day period, even since Omicron really was first detected in the world. So it may be too soon to even know whether that's possible or if so, how common it might be.
Thank you for those, and thank you for everyone who submitted questions. We're now going to turn it over to our live Q&A period. I do want to remind folks that the purpose of this briefing is to inform and educate the public on the status of COVID-19 in South Carolina and answer any questions you may have about it. Any questions or requests about issues other than COVID should go to our normal media relations channel at media@dhec.sc.gov. So I see some of you already have. If you have a question, please raise your virtual hand and I will recognize you in the order in which you raised it. And out of fairness, I'll try to get to everyone who's asking a question first before our return for follow-ups. I'll also add that a recording of today's briefing will be available later on this afternoon on our YouTube page. First question today goes to Kaylin Cassidy. Go ahead, ma'am.
Hi, Dr. Traxler. I wanted to know what counties the 2 cases of the BA subvariant were found in.
I do not have that level of detail. I do believe that they were our Midlands region, but I don't know the county, to be honest. I'm sure it was reported to us. I don't know that.
Alrighty, thank you.
All right, thank you, Kaylin. Lana, go ahead.
I'm sorry, I can't hear.
Are you at all concerned
Lana, I have having trouble hearing you.
Can you hear me now? I don't know if this is any better.
Yes.
Okay. Are you concerned at all about anybody doing the rapid tests incorrectly for that test to stay program? Or what would you say to school districts who are nervous about it?
So there is the potential for that to occur, either intentionally or accidentally. But we really are counting on parents and guardians to do the right thing in this situation. We are talking about the health of their children and their children's friends and teachers. And so we do require that attestation form or one similar that includes at least those elements to be used for a parent or guardian, to attest that the test was performed and done correctly on that child. But beyond that, we are counting on them to do it correctly. That's why, again, I am encouraging everyone to read the directions, follow them carefully, and to be honest about the results when they're reporting it to their schools, because this is for the benefit of their children.
Thank you. Simon Williams, go ahead.
Hi, Dr. Traxler. Thanks for meeting with us. My question is kind of about the surge that we're hopefully coming off of. With so many people testing positive in such a short amount of time, does a recovery mean that we're in for a mild spring?
So one thing I do want to remind everyone is while we are coming down off of this surge in South Carolina and in many parts of the United States, the entire world's not coming off of this surge yet. And with travel as frequent and as accessible as it is in this day and age, the reality is that viruses that are as transmissible as COVID-19's virus can be spread very quickly and very easily all around the world. And so while I am always optimistic and certainly am hopeful for an improved spring. It is not only dependent on us coming down off the surge in South Carolina. That certainly plays a large role, but there still is the potential for cases elsewhere in the world where they haven't seen their Omicron surge to still go on and dramatically increase. And then that anytime the virus is being transmitted more, it allows it to mutate more. And so we could get a new variant that's equally bad as Omicron, worse than, better than, it just time will tell.
Thank you. Dana Lynn, go ahead.
Hey, Dr. T, we got states starting to drop their mask mandates. Australia, which has a crazy, wicked high fully vaccinated percentage, has now taken what is colloquially being called the let it rip step. Basically, we got to learn to live with it. Are these things, are they premature, or are these just the inevitable steps that need to be taken slowly to learn to live with COVID? Because it ain't going anywhere.
So I can't say I'm a fan of the either the saying that they're using let her rip.
Yeah.
or necessarily that approach, but I do think that coming off of this surge, and again, hopeful for at least a period of time where we have a number of folks with some natural immunity and vaccination-induced immunity, maybe, seeing a little bit of calm. I do think this is an opportunity for us to start looking towards the future and how do we get this down to that level, and what is that level that we all are comfortable living with, and not only what that level is, but how we get there, and doing it in a very logical, smart, data and science driven manner. And so I believe that we are starting to see many places do that. Those discussions are going on at all levels, all across the world. But I do think that it needs to be well thought out and careful, and more of a stepwise rather than a let her rip approach. But it may be time to start looking towards that direction.
Thank you. Caitlin, did you have a follow-up?
Nope, just forgot to put my hand down. Sorry about that.
No worries whatsoever. Simon, do you have a follow-up, sir?
Yes, real quick, this is kind of an extension to, I guess, what we were just talking about with Dana's question. From what we've learned about reinfection and severe illness, does several people having antibodies right now at the same time mean that we could be facing more mild infection in the near future?
So that is a possibility. Again, a lot of it is going to depend on this virus and its behavior and what it does. As it circulates, how much it's able to mutate, and that will depend again partially on how much it can circulate, and whether those mutations are in key areas that cause it to, produce more severe symptoms versus more mild ones, whether or to what degree prior immunity will, prior infection will provide immunity. All of those are questions that are really going to be dependent on what the next variants of the virus look like. But I again would be hopeful. The more people that have immunity, then the more likely we are that there's going to be less transmission, and along with less transmission, then hopefully less severe mutations and less severe illness.
Anything else, Simon?
No, thank you very much.
Thank you. And this being the end of our questions, I see no more hands raised. I just want to thank everybody for tuning in today, for your continued coverage of COVID-19 in South Carolina. And thank you to Dr. Traxler for your time today. Thank you all.
Stay safe.
Bye.